As a group, young people's mental well-being seems to be deteriorating. There are all sorts of ideas why. We've grown up with social media, had our education disrupted by a global pandemic, and we face big geopolitical, climate and technological challenges. But there's less stigma too in talking about things like mental health. My name is Tilly Bennett. I'm a second-year undergrad at Manchester Uni and I'm 21. My mum is Dr. Jacks Bennett. She's a population health researcher at Bristol Uni and a School for Public Health Leverage Fellow. Universities like mine are great settings for public health prevention work. 1 in 2 of us will pass through UK higher education before we're 30. My mum's research field suggests that not only is student mental health deteriorating, but growing numbers of us now need wellbeing support while we study, with more students declaring mental health conditions and disabilities than even 10 years ago. That leaves universities in a tricky position. How do they support us all? My mum is trying to understand whether student mental wellbeing is actually getting worse, who is at most risk, and what we can do about it. She says good data is key. My stats tutor would agree. She is now working with 7 years of data at one university where 90% of all registering students have had their wellbeing screened each year. That's not just a one-off student survey where not many people fill it in. It means for the first time my mum's team can look at what factors might really be linked to changes in our wellbeing. The wider project is called the Student Wellbeing Study, and the plan is to bring more UK universities together to track student wellbeing, like they do our grades and outcomes. It will help with monitoring trends over time to see how political and policy changes might have an impact. It also offers a solid basis for measuring which public health and wellbeing interventions really work in higher education settings, all of which will help to successfully launch us into an ever-changing world.